I'm going to read from Matthew chapter 5, verses 14, 15, and 16. Matthew 5, 14 through 16. You are the light of the world. A town built on a hill cannot be hidden. Neither do people light a lamp and put it under a bowl. Instead, they put it on a stand, and it gives light to everyone in the house. In the same way, let your light shine before others, that they may see your good deeds and glorify your Father in heaven.
May I have that clicker there? Thank you. All right, the technology's working. Unfortunately, I think our internet's down again, so I was planning on announcing to our potential listeners in Florida that we have snow again, so they can smile maybe a little bit. So, but I guess we're down. Oh well. Maybe they'll listen in recordings. So if you don't know me, and maybe you're new to the congregation, maybe you're visiting, I am not one of the regular ministers or preachers here. I am maybe an irregular visitor, guest speaker, so to speak. I am one of the elders here, but I've come to kind of give a report, I guess, of a mission trip that I and my wife participated in last month in January. This is not our first time, and for many of you, this is not your first time hearing me give this report. So actually, I've gone, somebody asked me this morning how many times have you gone, and I can't remember oftentimes, but I have recently counted up my name badges that I've gone through, and I have 14 of them, so I must have done this 14 times. I'm not sure I've presented this lesson 14 times, but I have presented it a few times. Many of you will probably recognize a little bit of what's going on here. So I went on a mission trip to Guatemala. And you might find that subtitling there of the words surgical evangelism to be kind of a strange combination of terms, but it works. I'll explain how that fits together here as we go through this lesson. But I love this photograph that somebody shot when they were on one of these trips. I wasn't the photographer on this one, but it shows Christ above, it shows the cross above a volcano, and we'll probably visit this a little bit more down the road, but Guatemala is a land of volcanoes, so that's kind of characteristic of it. Just trying to think of anything else I wanted to say as introductory. Can't think of anything else. Okay. Butch is presenting a lesson, or completed his quarter of a series of lessons on this idea, people who are sent. He's trying to teach us a little bit of missions. And I learned a lot from his class, and I think this is part of what we're doing as far as Alina and I going to Guatemala. We felt sent. We felt that there was something that could be shared. The specifics of that I'll get into in a little more detail in a little bit, but and it's part of our idea of gathering and scattering too. We're scattering seed, so to speak. What we're trying to do is sow goodwill down in Guatemala, so that the people that don't have access to, I guess, modern health care, modern surgical health care, will get it, and because of that, have an opportunity to maybe bond more with their local congregation. And it comes from this idea, why do we go? And it comes from this idea that Butch kind of made a light shine or a click in my mind a couple years ago, and he said worship is the natural response to understanding who God is and what God has done for you. It kind of reminded me of that part of the 23rd Psalm where my cup overflows. That this idea, I want to keep this real simple, okay? This is the why we go. We go because, well, we can. because we're able to, and it's a attitude of gratitude. We're grateful for what Christ has done for us. The fact that Christ has died for our sins, and that we have this hope to look forward to in the next life of being restored to our Father. And we're hoping to have this eternal relationship with him at that point in time. And because of that feeling of gratitude, you kind of have this overflowing. And that phrase again, my cup runneth over, that comes from the 23rd Psalm. That's a really interesting psalm. This is written by David. David, who was a shepherd and then became king. His theme, that the first words of that psalm speak to his appreciation, how God is his shepherd. The Lord is my shepherd. How he oversees his life. And one of my favorite verses out of that is, though I walk through the valley of the shadow of death. I'll let you complete that in your head ahead of time. You'll fear no evil because God is with him. God was with David. God felt his shepherding, his guidance. And the final phrase of that psalm is that I will dwell in the house of the Lord forever. This idea, this hope of eternal indwelling with God. Now David had no concept of Christ, although those ideas are in that psalm, though, that ability to dwell with God forever. It's something to look forward to. David, and that's why he described that his blessings overflowed. And he knew that there would be, that there is evil. Though I walk through the valley of the shadow of death, he knew that there is evil without and within. He even knew within him there was evil within him. He understood that, because that next phrase after the shadow of death is, thy rod and thy staff, they comfort me. A rod is what's used to correct the wandering sheep. He understood that he needed correction. He understood that thy rod and thy staff, they comfort me. That he knew that God was shepherding him, moving him, causing him to go where he needed to go. So that's why his cup overflowed. That's why he felt this gratitude. That's why we feel gratitude. That's why we go. This idea of loving God is found in many places. In this specific answer to a question, you must love the Lord your God with all your heart, that answer to that question comes in all three synoptic Gospels, Matthew, Mark, and Luke. And it gives us sort of a clue as to what God wants and how we should serve him, how we should display our gratitude. So in this instance, in Matthew 22, a person asks him, "Teacher, which is the most important commandment in the law of Moses?" Jesus replied, "You must love the Lord your God with all your heart, all your soul, and all your mind. This is the first and greatest commandment. The second is equally important. Love your neighbor as yourself." When Luke gives this similar answer, or the same answer actually, the question isn't exactly that question. That question in Luke is, what must I do to have eternal life? Similar idea. Same answer. Love the Lord your God. And I think that we can look around and understand that how we love the Lord is by loving our neighbor. How we love the Lord obviously includes following his commands, doing what's right. That's what he really wants, he wants us to do what is right and good. Because there are things that are right and good and things that aren't. And we need to avoid that which is not good, evil, and do that which is good. And so this is what we're trying to do. And so this is the why. This is what motivates us. This is our understanding of what we're trying to accomplish with what I'm about to describe and what we did. So I'm a surgeon. For those of you that don't know me, I'm a surgeon here locally in Troy, and I've been one for 30 years now. and all these years, I've always tried to figure out a way that I could be able to marry this idea of my gift as being a surgeon and this idea of being able to evangelize, that is, to bring the Word of God or understanding of God or a sense of God anyway to people. This organization, Health Talents International, their website is healthtalents.org, they help me do this. Okay? They're the means for me to be able to become a surgical evangelist, so to speak. Now, unlike what Butch was talking about in his missions class, where he and those that he trains goes to foreign fields after a lot of training and stays for long periods of time, usually years, we aren't that. We aren't that kind of mission where we go and we stay. We are really, as part of this organization, they tend to send teams to foreign land, in particular into Guatemala, and they only spend about a week's time there. Now, they send a team there, what used to be about 1 week out of every month of the year, but right now, recently, they're going a couple weeks out of each month, so it's up to almost 18 mission trips are planned for 2026, and I think that they're kind of increasing them. But healthtalents.org is the website. If you want to know more information about them, that's how you look them up. Because a lot of times people ask me about it, and I think they do a great job in evangelizing and bringing Christ to the people of Guatemala, and they're trying to go to other areas as well. They have many programs. It's not just that mission trip thing at the bottom where we go in with a team of people. It's they have other things going on. They also have something called an ABC Child program where you sponsor a child, and they have you can provide the funds for that, and they can go through a church-sponsored organization to help meet the needs of all those, even those that live in the more rural communities, to have adequate health care, dental care, school supplies, education, things like that. That's what the ABC Child program. If you want to know more about that, it's on the website. And they do other things as well. They also train about medical evangelism, and other things. They have programs, and they've been doing this for a number of years, long before I had been involved with them. I think the first person that got me started with this was Tim Hickerson. He said, "Hey, have you ever heard of Health Talents?" And I hadn't, and he said, "Well, they do a lot with surgery, and you might, as a surgeon, you might find that useful." So I can thank Tim Hickerson for kind of opening that window for me, and I seized it, and I'm glad. So who are the patients served by Health Talents? Well, they serve patients who often have little or no access to quality health care. Many of those who are served in the rural fields are underserved urban areas throughout Guatemala. They face significant barriers due to poverty, distance, and limited medical resources. The patients include children, adults, elderly, and they are seeking relief from pain, restoration of sight. There's a lot of trips that they do ophthalmology, life-changing surgeries, and compassionate care, all offered with dignity, respect, and the love of Christ. And that's made very clear to them as we discuss this again in the future. Excuse me. We partner with the local churches of Christ in Guatemala, and so that is their main input. Who are the volunteers that go down there? Well, they come from all over the U.S. Lena and I were just part of 600 or so, over 600 volunteers that went on mission trips to Guatemala. And it includes surgeons and physicians and nurses, CRNAs, that's a nurse anesthetist. Those are the people that usually, they're the ones that pass the gas, or whatever you want to call that when people are put under an anesthetic. Dentists, eye care professionals, physical therapists, caregivers, translators, students and non-medical support volunteers. I should probably step back and say, I'm giving this talk at the request of many in this congregation. I have not been asked by Health Talents as an organization to give this talk. The elders in the past have encouraged me to give the talk because it's encouraging. And that is my main purpose, simply to encourage you to also look into your own lives and figure out a way that you can give. Give of your time, give of your talents and things like that. But yeah, Alina and I were never supported by Mid-County. We did this all of our own, and I would encourage you all to consider doing that. If you are, if you've been blessed by God in a way that you find yourself in a position to give, consider giving. Consider giving in this way. I would encourage you also, obviously, to give locally also. That's important, as Alina and I also do. But you can give. And I should probably point out that last sentence there. These volunteers work alongside a Guatemalan staff. So Health Talents is actually involved in the country of Guatemala, has employees that they support in Guatemala also. So there are Guatemalan staff that are there all the time as well. All right, so preliminary. So some of you may ask, well, where in the world is Guatemala? Well, Guatemala is in this part of the country, part of the world called Central America. As you can see, it's highlighted in green there. It's between Mexico, the southern aspect of Mexico, and South America. This region, this area known as Central America, has 7 countries in it. Many of the countries will span between the Atlantic on the right side of the map there and the Pacific on the left side of the map. Guatemala is actually one of them. It crosses between the 2 oceans, just like the U.S. does, from sea to shining sea, I suppose you could call it that. But I'm often asked, where is Guatemala? And a lot of times I often have people confused. Are you going to Guatemala? Are you going to Honduras or Nicaragua? No, it's Guatemala. If you need something to help you remember, Guatemala sounds like guacamole, and that's how I encourage you to remember. That's the country that we've gone to so many times there. So here's a map of the country of Guatemala, a little bit more blown up. And I guess as part of anything that you do that's good, you often have to overcome challenges to it. And one of the challenges is getting there. And so Guatemala is about 5,000 miles away. It's not as far away as Bolivia, by the way, or Argentina. Those are much farther. Trish and Butch travel much, much farther and for longer periods of time than Alina and I have done. But yeah, when you travel international, you take a chance. And so our first plan was to fly from the Dayton airport to Guatemala City, which is their main hub, and from there you kind of branch out. We were hoping to get there on actually Friday, January 9th, and because of United Airlines and delays and things like that, we ended up being 3 minutes late to one of our connecting flights. They left without us. So we ended up spending the night in Houston and flying out the next morning. And then the next morning, we were hoping to go catch up with the next the crew. Actually, the crew, the main bulk of the crew that went down in January, actually most of them came on January 10th also, but they made it to the capital city and to where the bus picked them up from the airport by the early afternoon. Unfortunately, our flight was not early afternoon. We arrived in the late afternoon, so we ended up having to spend the night, just the 2 of us, in Guatemala City, which, we've done that before actually, but it's a little scary when you travel to other places, and so the coming and going and all that, it's a little exciting. That wasn't nearly as exciting though as the trip from the capital city out to the clinic. There's a little blue arrow in the bottom there you might be able to make out. That represents actually the distance traveled. It's normally about a 2.5, 3 hour trip, but the young Guatemalan that took Alina and me there was kind of a lead foot driver. If you want to know more details about that, you can talk to Alina. we were kind of thinking in our hearts at the time, we were really putting our lives in the hands of God to have this type of travel, because nobody passed us. We passed everybody else on the way out there. We were flying. Made it there in record time, but then again, we did make it there alive and safe. We made it there alive. So we spent the week there, January 11th through the 16th, through Friday, Sunday through Friday. Yes, we operated on Sunday afternoon all the way until Thursday, and on Friday we left. We flew out. From, so we drove back to Guatemala City, and we actually had trouble getting back too. There was the van that was supposed to take us there broke down too. No shortage there. Of course, we had to make it more difficult from our own calendar standpoints too. We had a wedding we wanted to go to in Kansas City from a family, and so we weren't flying directly back home. So traveling, just beware, those of you who are willing to bite the bullet, sometimes you need to be prepared to be flexible. And you might have to put up with a little bit of waiting, because you will, especially if you go through O'Hare, especially if you use United. Okay, so a little bit about the climate there. The climate is tropical. They only have 2 seasons. They have a wet season and they have a dry season. In January, you're in the dry season. That doesn't mean that it's super dry all the time. You're still in a tropical environment with high humidity and all that. That just means that it isn't raining all the time, which it tends to do from like May until maybe October. So pretty typical for a tropical environment. And in that particular elevation that we're at the temperature at the daytime tends to get up into the 90s. And in the night it cools down into the 60s. So it's nice, very nice. I mean, imagine right now you're looking outside. If you could look outside, you'd see a little bit of snow on the ground still. You'd probably say, 90 would be okay right now. But if you had that every day, you'd probably say, well, maybe this isn't so great. But that's that. And it's a beautiful, beautiful country. It's just green everywhere. They have these beautiful flowers. These flowers are called birds of paradise. They're everywhere. And they have many other flowers you've never seen in your life. And birds and monkeys and all sorts of other things that you would expect in a tropical environment. Guatemala is beautiful. And they have people in there also. And these are a good photograph of the people of Guatemala. Now, if you have paid attention to our news in the last year or so, I think Guatemala and a lot of Americans, that they look at Guatemala. Guatemala kind of has a black eye because of the news coverage that we have and all, but you might have the impression here in the States that everybody in Guatemala is trying to immigrate illegally to the United States. Not the case, not at all. Many Guatemalans are quite proud and quite happy to live in Guatemala, remain in Guatemala, and are even proud of their own country and their own heritage, which is perfectly legitimate, like we are here in the States, how most of us are proud of our American heritage as well. So just because you see that there are a lot of people in Guatemala that are trying to enter illegally, it is a hub for a lot of people from other places, Central and South America, to come into and try to get into the U.S., which then obviously they have to go through Mexico. That is the minority. That is a small percentage people. There are problems in other parts of the world. We'll talk about that in a minute. But most Guatemalans are just like you, made in the image of God. They are in need of help, and they have reasons for that. And I think I would say, without getting too political in all this, I think a lot of it's on the shoulders of the government, the leaders that they have chosen, that they have their problems. They have a socialized medicine where supposedly everybody has free health care, where they only have 50 hospitals in the whole country that are government run. So whenever you get into that situation, you'll see this in other countries too that have socialized medicine, that if you have this supposed free health care, usually it's totally inadequate to meet the needs of the people, and that's the case here too. If you were to look at the size of the country of Guatemala, it's about the size of Kentucky in terms of landmass. Yes, Ohio is actually a larger country. Ohio's larger than Kentucky, in case you didn't know that. But as far as landmass, if you look at all of the hospitals in Kentucky, there's over 120 of them, and lots of lots of better access. Now, if you're from, there are certain parts, I'm sure, if you were to go to in certain parts of Kentucky where they would say, oh no, we don't have adequate access to care. That may be true, but it's nothing like what it's like in Guatemala. Guatemala is known for their elaborate weavings, and they do this by hand. They're known for being of Mayan heritage. Okay, the Mayans were an ancient civilization that predates Columbus or the colonial period, and that still exists. Some of that heritage still exists in that country. But as you can see there, they have a very distinctive what they wear. They're very, very beautiful. They have their own culture, as you would expect. Now, in the States, you probably see a crowd of a whole bunch of children riding in the back of a truck at speed, and you probably cringe a little bit because it violates your sense of safety, and it might, and it does, and it still does mine. I'm reminded every time I show this photograph here. They live differently. This kind of still reminds me of that little trip that Alina and I took from the Capitol building out to the clinic. This is kind of what we were working with here. And their infrastructure, their roads and all that, not like what you have here in the States. There are lots of potholes, lots of, there's no signs, and you might be going 50 miles an hour, and there is a big old, huge divot in the road. So you got to be careful of that. So the drivers, let the buyer beware. No, let the driver beware. You have to really be careful. There's not the infrastructure that we enjoy and take for granted. To be honest with you, what we have here in the States. But they obviously have a lot of children, a lot of happy children. But they don't have. And speaking of infrastructure, they don't have the utilities that we have here in the States. We are also used to clean water. Turn a faucet on, you can drink right out of it wherever you go. Not so in Guatemala. A lot of places don't have indoor plumbing, which, by the way, is much like much of the rest of the world. You are in a privileged country to have this, which we often take for granted. This gal is doing her laundry in a local river, and I'm sure that she gets her clothes quite clean, or as clean as you can get in Guatemala. But this just brings you back to, hey, you need to look around at what you have and what you take for granted. All right, little population, little demographics. So the bar graph in the middle, in case you can't read the captions at the bottom, that's Guatemala. The two bar graphs on the left and the right. The one on the left is the population of Ohio, which is around 12 million people here in Ohio. Bar graph on the right is the population of our most populous state, which is California, 39 million, and which is decreasing as we speak, probably. But anyway, but Guatemala has 17 million in their country, so a very populous state. There are more people in Guatemala than there are in the state of Ohio, just to give you a little context. Okay, and Guatemala, like I said, is a relatively small country. It's smaller than Ohio. It has more people, and so that obviously tells you that it's more population dense. Average salary per month in Guatemala is about 1/10 of what it is in the U.S. Life expectancy is a little lower. It's not, you might expect, it's only 40 years. No, that's not the case. It is lower, but it's not phenomenally lower than what you have in the States. So they have some things, but they clearly don't have what we have in terms of access to health care. That is no question about it. The access to surgery, for instance, I've seen firsthand, obviously, over the course of many years, that they just can't get the help that they need through their public system because it's just not there. They just don't support it adequately. And probably because it would cost too much for a social system to socialize medicine to do that. That's my opinion on that. But anyway, they don't have the access. So we those that provide health care coming in on a temporary basis are definitely needed. And it gives us an opportunity to link up with the local churches, which I'll remind you of in a moment. Okay, this is a graph I've shown in past presentations. It requires a little explanation. I know it probably looks like a whole bunch of bubbles. This is from the year 2023, which is and this is from a website called Gapminder, if you want to look this up, gapminder.com, I believe. And it just plots out the countries of the world represented by circles. The colors represent different regions of the world. The Western Hemisphere, the Americas, are actually the green circles on this map, or on this plot. And as you go from, on the x-axis, from left to right, you're talking about increased incomes, the different incomes. I'll get into that a little bit more in just a second. And on the y-axis, from the lowest number to the highest numbers, is life expectancy in years. The two big red circles, if you're wondering what are those things, well, those are India and China. Those both have very large populations, and they're both in different places. But the big green dot on the far right of that image, that's relatively high up, that's the United States. But what I want to call your attention to is these things called income levels that they have here. This is just, I think, a useful way for us to keep in mind where we are and what privileges we enjoy. We forget to. You'll see income levels 1, 2, 3, and 4, and they're subdivided on that graph vertically. There, they don't draw hard lines in there, but as you can see, there are. Well, let me just go on and explain what income levels, how they figured this out. So each figurine on this income level represents 1 billion lives, 1 billion people, 1 billion with a B. So there's level 1 is the billion in the world that live on an income less than $2 a day. So they have significant challenges. It's hard. They usually don't live. They usually live in dirt. They usually have no plumbing. They usually lots of other things that go along with income level 1. And about 1 billion people in the world live at that income level. Surprisingly enough, 3 billion people live in income level 2. That is, that their income is between $2 and $8 a day. That's almost half the population of the world, by the way. At income level 3 is those that live between $8 and $32 a day. And then there's 1 billion people or so that live at greater than $32 a day income. That's where the U.S. is, as you might guess. Surprisingly, Guatemala actually falls into income level 3. They're just barely inside income level 3. I looked up Bolivia just for curiosity's sake, and they are very close to the upper limit of income level 2. Okay, so I would say they're very close. So this is what you're dealing with there. Just to refresh your memory, the ghosted out green bubble there I've highlighted with an arrow. Again, that's where we all live. We live in the United States. We live at much greater than $32 a day income. Probably all of us do. But remember all that. That has a lot to do with how you live your everyday life. That's the environment that you live in. That's not God. God gives everyone equal chance. We all are, he sends the rain on the poor and the rich. We can go into that in more detail maybe at another time. But that is where Guatemala is on this little graph here. And this is another graph of density or distribution of surgeons, anesthesiologists, and obstetricians, why they distributed it that way. But these are the specialists, and the darker the green, the more dense that there is. That is, they have greater access. So although the United States is among the darker of the greens, there are places in Europe that have even more surgeons, anesthesiologists, and obstetricians in close proximity to one another than the United States does. But if you were to look where Guatemala is, way down here, you probably can't see it, but they're a very faint color. They don't have great access. There aren't many obstetricians and anesthesiologists and surgeons, so there's a need. They just don't have the personnel there. There are probably lots of reasons for that. I think that a lot of them have to do with their governance, but that's another discussion for another day. But because they don't have that, there's a need. So if there's a need for that, that's where Health Talents comes in. And Health Talents has not only this mission program, I'm going to go back to that now. Health Talents also has something called the ABC program. I briefly introduced that at the beginning. ABC is just a program where they support children with their health, their schooling, and just support the family under a church-supervised program. So there are a lot of the problems that you get into when you're just sending money to somewhere, they kind of oversee that and make sure that they don't get into trouble with those things. Alina and I have supported an ABC child many years now. We've supported one for a while, and we have a new one. This child, his name is Wilson, and this is his picture of us getting to actually meet him. That's one of the nice things about this program, and also participating in the mission trips. I get to go down to Guatemala, Alina and I get to go down, and we can actually meet the people that we're supporting. That's Wilson and his mother. This is year 2025. But we met with him again this year, and there's a big difference with Wilson. It was pretty interesting. I'll zoom in a little bit here just so you can kind of look at that yourself. The new hairdo there, I thought you might find interesting. So even though Wilson lives in a relatively rural area that speaks mostly Quiché, and he likes to speak Spanish, and he considers his favorite class is Spanish, by the way. It's kind of like if you were to talk to someone here and they say, what's your favorite class in school? And you would say English or English literature, think they're studying English. That's what his is. His is Spanish, which is fortunate because his community where he lives is mostly Quiché, and Spanish is not the main language spoken there. But Wilson does speak Spanish. Probably translates for his mother also a lot because she did not speak very much. And so we got to meet with him, and if we didn't have this gal, Rachel Finney, our translator, she met with us and she helped to bridge the gap between things here. Yo puedo hablar en español un poquito, okay? I can speak a little Spanish, okay? And it's important when you go to another place that you try to learn their language and be able to get along. I can get along a little bit, but when you're talking with people about health issues and you're trying to explain to them something as important as an operation, a surgery, and what things are going to be like afterwards or what they could be like, and all that, you've really got to be sure that you're communicating as best as you can. And my Spanish is inadequate to get to that level of understanding. So we routinely bring down translators. Rachel, the gal in the middle there with the long curly hair, she teaches Spanish in Virginia. She actually teaches at the college level. And she's been going down to Guatemala as part of the January HTI trip as long as Alina and I have been going. So we have a close relationship with Rachel. But she's really special. And without our translators, though, we would be lost, and I think that we get into a lot more trouble. So it's not just healthcare professionals, it's also all those that support us. You might even look at you see that we bring down like 50 people, you probably would say, wow, you surgeons are really needy. And that's true, we are. We need a lot of help. We need nurses, we need anesthetists, we need a lot of support, and we need translators, very much so. Okay, so they put me in charge. There are 3 ORs down at that clinic down there at that hospital. It's called Clinica Azel Hospital. It's just named after a sponsor, but it's been going on for many years. They kind of left me as one of the surgeons, one of the general surgeons that week, in charge of OR Room 1. They have 3 ORs, and those are the people that I was in that room that whole week. On the far left is an anesthesiologist, and he, right next to his left, the next guy in, is his son. And his son is a critical care nurse at the moment, but he looks to going into anesthesiology or being an anesthetist in the future. So that whole week was kind of fun to watch this father-son relationship as he's showing him how to put in a spinal block or something like that. And it was just kind of fun to watch that. It was like a mentoring relationship. It was really kind of fun to watch. And I would be remiss if I did not mention my partner in crime, who goes down with me. She has not gone down to Guatemala on every single trip, but I've learned that when she doesn't go, things are not as good. And so I really do appreciate Alina coming down. She is my greatest supporter. I wouldn't be able to do this without her. So she goes to this strange country that speaks a language strange to her, although don't let her fool you, she does speak a little Spanish also. But she doesn't have healthcare training, but nevertheless she finds ways to be helpful. And our whole idea of going down there and trying to relieve suffering and all that is to establish a sense of goodwill. Goodwill that can then be transferred to the local churches. How would that happen? Well, it's because the local churches are the ones that sponsor the HTI medical missions to come out and see people in these churches where they find the patients for us. They don't find the patients when we're down there. When we get down there, we've already got a long list of patients that need surgeries. Excuse me. And this is just a photograph of one of the many local churches in the region of that area. They go down there, and the Guatemalans, the local Guatemalans, will go first to their local churches. They'll get screened. If they have a surgical problem, then they'll get referred to us, HTI, and then we take care of them. And after we take care of them, they go back in their communities, and they do not remember my name or my face or the help that I did to them. That what they remember is the local churches. And that's how I think I can justifiably call myself a surgical evangelist, because I am gaining goodwill for the local churches so that they can preach Christ to them and support them. So there they are. That's local congregations. And this is all with the same idea. What Derek already read to you this morning. Matthew 5, Jesus is presenting his Sermon on the Mount. He's just gone through the Beatitudes, and he's telling them that they're not only, that they're salt, and that they're also light. You are the light of the world. A city set on a hill cannot be hidden, nor do people light a lamp and put it under a basket, but on a stand, and it gives light to all the house. In the same way, let your light shine before others, so that they may see your good works and give glory to your Father who is in heaven. That's the whole idea. That's the simple truth of it all. So we try to impress upon the patients as we meet them before surgery and afterwards. And we will pray with our patients. I often prayed with my patients before surgery, and I emphasized how my prayer was that they would have a surgery where they would feel no pain, that their problem would be taken care of, and that in the long run they would give glory to God who is in heaven, and go to the local churches that sponsored them. This is not me who's praying right there. That's one of the other general surgeons, but that's just a reminder for me to talk about that aspect. We try to pray with the patients. We try to make it a tight link between what we're doing and Christ. And so what are we doing? So we're doing a lot of operations. And I'm a general surgeon, and I deal with a lot of problems with this phenomena called hernias. A hernia is a hole through which something protrudes. Several of you have had hernias. I think some of you could probably attest to that, how they hurt, and if you don't get them fixed, they can often interfere with your activities of daily life, including work. So that's what the general surgeons tend to do. We tend to fix a lot of hernias. We had a gynecologic contingent that went down. They fixed a lot of problems that are in the female variety of problems. They often have the ophthalmologists come down and do like cataract extractions and things like that. And these men and women who are doing this are restoring light, or restoring sight to the blind. Okay, they were blind, then they're able to see. dentists come down and perform dental procedures and dental care. There is a lot that they do. So the general surgeons tend to do this more than anything else. When I do hernia operations here in Ohio, I more often, probably about 9 times out of 10, I'm typically using this gadget here, the robot, and that's a Da Vinci Xi robot. It costs $1.4 million for one of those. So you don't have those in Guatemala. You don't have those anywhere in Central America. And I even asked the Da Vinci people, okay, are there any even in Mexico? And they said no. So unusual to have access to that. What this does is just makes the operation, it's more doable through smaller incisions, makes less pain, quicker recovery. But it's not there in Guatemala right now, so I still have to stick to my old-fashioned open surgery for this. And what did I specifically do as the week went by last January? I did 17 hernia operations, and I did 3 what I typically just summarize as lump and bump operations. So 20 operations, that was room 1. There were 2 other rooms. They did a lot of other stuff. We helped a lot of people. We relieved a lot of suffering, we hoped to. This is what the compound looks like. You can see another volcano in the distance there. Volcanoes are real common. You can actually see some that are actually erupting. I can show you a photograph here on the next one that'll show this exact same view of this photograph at night. And you can see the lava coming out. So yes, there's volcanic activity is still prominent in Guatemala. It's not as big as Hawaii's big volcano, but it's still interesting to see. Reminds us, we are a small part of this big creation that God made. And this is their typical village community in Guatemala. I thought a lot of times I'm being asked, well, show us more pictures. And so here's just a few more pictures of that. These are 3 little girls that you might see coming in the distance here. Is a little closer up shot of them as they come in their little traditional dress there. Just thought you'd appreciate that. Just one more little taste or flavor of some of the villages in Guatemala. So am I trying to tell you that you all need to become surgeons and go to Guatemala and do what I do? And I think you obviously know that it's not the answer. You can do whatever it is you can do that helps people. In Matthew 25, Jesus tells about this end times reckoning, so to speak, of the sheep and the goats. And he says to the sheep on his right, these are these things that you did for me. And he says to the goats on his left, these are the things you did not do for me. They both ask the same question: in what time did we do all these things that you did? And many of you already know this account in Matthew 25. And it kind of gets summarized in this single verse, verse 40. The king will reply, "Truly I tell you, whatever you did for one of the least of these brothers and sisters of mine, you did for me." Other translations, inasmuch as you did for the least of these, you did for me. You get the idea. Do good to those around you, and that will be considered. Okay? So I would encourage you, so no matter what your gift is, and you all have gifts. You may think you don't, but you do. You just need to spend a little time thinking about it, talking with other people. You are all gifted in some ways. If you have the ability to give, if you are put in a position to give. This is your means of loving God by loving your neighbor. If you can find a way to do it. You do not have to go 5,000 miles away. You can do it in your own backyard. We have other programs right here in Mid-County. Walk for Water comes to mind, and there's many others that you can do, that you can give. You can find a way to give. I would encourage you. This is something that Aline and I have done for many years. I hope that you found this encouraging. And I hope that in ways you will find ways to be able to relieve comfort of other people. This is how Paul describes God to the Corinthian church in the second letter. All praise to God, the Father of our Lord Jesus Christ. God is our merciful Father and the source of all comfort. He comforts us in all our troubles so that we can comfort others. When they are troubled, we will be able to give them the same comfort God has given us. For the more we suffer for Christ, the more God will shower us with his comfort through Christ. That's the idea. Trying to get you there. So, there's my presentation. Hope you've enjoyed it. This is a time when we usually pause and offer an invitation. So I've given you a lot of information. I've given you a message. If you are at that aha moment where you understand, yo comprehendo, you understand what's going on, and it's time for you to put Christ on, this is your opportunity to do that. If you are carrying a burden that you don't want to share alone, that you would like the prayers of the congregation, this is your time also. You may come, as we often do, to the front rows, and someone will serve you. So if you are subject to the invitation, please come while we stand